had not been for the Palmetto Volunteers in Medicine getting me back on my feet.
It's a blessing. I don't have to worry about whether I've got enough money to take my wife to the doctor.
So many of us have no family to turn to, no loved ones to help support us. This organization does.
Palmetto Volunteers in Medicine began after a visit to the Volunteers in Medicine clinic by me in Hilton Head, South Carolina. I was so inspired by what I saw, I felt like I wanted to be a part of something like that when I retired from the active practice of medicine.
What the clinic's done for me has just been tremendous. It is just, I guess the times are pretty tight, you know. I work with the church, but it's not a paid position, so I do handyman stuff on the side wherever I can get it and whatever I can do, obviously.
Well, I originally moved here under doctor's advice from the Cleveland Clinic because I had asthma and chronic bronchitis, and the winters there were literally killing me. I had a job and lost that. With downsizing when the company was sold, started my own business, could not get medical insurance because of health problems. Eventually I just got sicker and sicker and sicker and could not work anymore, and because of no insurance and no income, I couldn't get medical care.
I think the thing that really drew me to the clinic and its work was just the needs that I see every day in the community.
The population of York County has 227,000 people. As the clinic opened, there were approximately 42,000 residents without health insurance. That's almost 20% of the entire county without any type of medical coverage.
Immediately following my layoff, of course I lost my insurance. And of course I became very, very ill, very sick, respiratory-wise.
When I've learned what doctors like Dr. Hildebrand and a number of other still active doctors are doing free for patients who can't afford their health care, and nurses that are giving their time, medical staffs that are giving their time, hospitals are giving time and money, both here and in Charlotte. It's incredible the response that we've gotten from the medical community.
As I was working, I became ill. And I always have worked 2 jobs, a 8-hour job and a 7-hour job.
I see this group doing more and more good work and taking care of more of the people who continue to drop between the cracks.
I got with a company that was with General Motors, and General Motors canceled out the contract during the recession, and it just throwing everybody on hard times.
I can't imagine how it must be to a parent who has that sick child with injuries or illnesses and doesn't have the ability to pay.
We at Carolina Orthopedic Surgery Associates have treated some of the patients from the Palmetto Clinic in Rock Hill.
What caused us to really get involved and be willing to offer funding was a visit to the clinic itself. There's nothing like seeing on the ground what is transpiring there.
The types of patients we see obviously are patients that need a lot of medical attention. They have various disease states such as diabetes, high blood pressure, a lot of respiratory type problems, things like that.
We just have a heart, or I have a heart and my wife as well, to give back to the community. I mean, we've really been blessed to be put in the position that we're in. And we just feel like we need to help those people who need our help.
I first went to the clinic 2 years ago because I was suffering from fibromyalgia. And the other doctors that I had visited, and I'm talking about specialists, all they ever did for me was give me pain pills and send me home. And I couldn't function on pain pills.
I worked in the ministry and I helped other people. And I see a lot of the people coming to the clinic they're working people too, and they were working people. And they are struggling now. They're trying their best to do, and they don't like taking anything from anybody. I don't like it. But I'm gonna tell you what, I'm thankful you're here, and I'm thankful you're helping us.
I mean, I can barely afford to live, much less pay medical bills right now in my life.
My potential goal is to return to work because of the clinic and the help that I have received.
I felt that the care that I received was above the professional form that I'd ever received in my regular doctor's office when I did have insurance. They were on top of their game, from the nurses that checked me and my blood pressure and my weight to my doctor who saw me.
It's not just an older population. The problems of lack of insurance affect the entire population.
What motivates me to volunteer at the clinic is to obviously want to try to give back to the community some in some way, shape, or form, and feel as a physician that's something I'm just inspired to do.
Made the statement that unless this could be a community project, it would not be successful. And we have had very good community support.
Piedmont Medical Center is Palmetto Volunteers in Medicine's biggest financial supporter. Carolina's Medical Center donates close to $100,000 in lab work each year.
I think one of the things that really hits home is the need for quality health care to be available to folks in our community who may not be able to normally afford it. And it touches all of us at some point or another.
You know, I think there's a saying that no community can be considered a healthy place to live unless all of the people that live in that community have access to basic health care.
I would encourage people to give to this clinic and also to volunteer their time because, as I said, they've really been a godsend to me and a blessing. And I met people in the waiting room. I thought I had problems, but I met one lady and she was ravaged by cancer, and they were helping her. And things like this really moved me. And if I can ever help them in any way, I will.